My name is Jean and I'm the office kinesiologist. Every day I see people with different symptoms from their peripheral neuropathy. When they start treatment, they may have balance issues, pain while they walk, or cramping during the night. Some have even fallen and would do anything for that to not happen again. But after I explain to the patients the root cause of their condition and how it can be easily treated without medicine, surgery, or physical therapy, their eyes just light up with new hope. The nice thing about what I do here at the center is halfway through the patient's treatment, I not only get to visually see their improvements, but get to hear them verbalize their excitement and their increased quality of life. So I truly love what I do here and would like you to hear from some of our patients and see how they're feeling through their treatment. Prior to treatment, what was the big issue?
Tingling in my legs from the knee down, just a really light, odd sensation. And I was going to yoga a lot, and it seemed that my balance got worse and worse.
If I have to walk a couple of blocks because I couldn't park close enough to the library, I find that walking to the library is, it gets a little difficult the further I go. And my wife, when we go to a movie in park and we walk 2 blocks, I can't quite keep up with it.
Yeah.
So it affects my speed.
So Faye, how are you feeling at this point of your treatment?
I think I'm walking a little faster. When I go to the grocery, I get a cart, not because I'm going to fill it up, but I hang on to it. But lately I haven't been getting a grocery cart to hang on to because I can walk by myself.
Dan, you're in week 5 of treatment and you just came back from Hawaii. That was exciting. How are you feeling?
My legs and feet feel better.
You feel better? That's great. How can you tell?
Well, I was walking quite a bit at an airport. You know how it is. San Francisco Airport, BART into San Francisco Airport, and then getting on the plane. Getting over to Maui, going down the luggage rack. Maui Airport's quite big. It's a lot bigger than I thought it was going to be.
Oh.
And walking down the baggage claim, coming out, getting a shuttle bus, getting, a rental car, etc., then coming back the other way. My feet never hurt me one time. My legs got tired, just tired, but I can notice a significant improvement in my feet, the pain in my feet.
Nice. So the
Because I walk
symptoms.
quite a bit.
So the symptoms have gone down?
Yes.
The last 2 weeks I feel much stronger. On weekend I'm running around with my girlfriend. Feel really fast.
Versus now, how has your cramping been doing?
It's not near as bad as it was before. Matter of fact, when I went on this vacation, I don't hardly remember much in the way of cramps. I don't have them like I used to have.
Good. That's great to hear. So they have either completely diminished or they.
Oh, they've diminished all right.
Okay. Wow. Nice. That's great to
I'm
hear.
glad of it because that's horrible stuff.
Yeah, it's pretty debilitating.
Yeah.
Since the beginning of the program, how have you noticed any difference?
My right hand is getting better.
Good. And you notice that you have more range of motion in your hand?
Actually, I do. I do my own hair now.
Oh, good.
I used to have a lot of cramps. A lot. I noticed having cramps lately.
Good. You feel some kind of improvement?
I do, and I don't know how to explain that.
Okay.
But it's not like I'm feeling nothing's going on in the right direction for me.
Yeah, I don't depend so much on my hands anymore. Or I can actually stand up without any support.
Yeah.
No problem.
I used to get my thigh, but I haven't had any of those.
How soon did you lose
What's
your
that?
cramping? How soon into the treatment did you notice your cramping had subsided?
I noticed gradually that it didn't have it as often as it had before.
Almost immediately, is that what you said? Or?
I took some cramping pills along with me, but I didn't have to use them.
Oh, good.
Yeah.
Good. Have you been taking that medication at all, or
What's
since?
that?
Have you been taking the cramping medication at all
I didn't take it for quite a while.
since the treatment? Great. I'm happy to hear.
Well, I'm happier than you.
I was practicing my yoga poses about 3 weeks after I started treatment, and I could definitely tell a huge difference in my balance, and I'm able to do the different poses much easier without without feeling wobbly. So that improved. And the tingling in my legs subsided significantly. Used to feel it like when I would go to bed at night and all throughout the day, and now I only feel it occasionally during the day. So that has improved significantly.
So then, have your expectations been met of the treatment?
Absolutely, absolutely.
And what are you able to do that you could not do before treatment?
I could do the tree pose.
Peripheral neuropathy. This is an often devastating condition in which people develop pain and numbness in their hands and feet, and basically they're told on the evening news that they should be taking this or that medication so that they can get through life. That's treating the smoke and ignoring the fire. Those medicines that you're seeing advertised don't treat the neuropathy, they only treat the symptoms. But what's causing peripheral neuropathy? Well, we know that in America, one of the biggest causes of peripheral neuropathy is being diabetic, which is clearly related to the foods that you eat by and large. Becoming a type 2 diabetic dramatically increases your risk for having peripheral neuropathy and, in fact, being devastated by it. This is a disease that affects 1 in 15 Americans. Let's take a look. So again, this is 1 in 15 Americans. This is 20 million Americans afflicted by this disease that, aside from diabetes, we are told the cause is unknown. Well, maybe that's not exactly true. Last month in the journal Neurology, an incredible study was published describing a relationship between what are called fluoroquinolones and the risk of developing a peripheral neuropathy. Now, you may not know what fluoroquinolones are, but chances are you may have actually been exposed to fluoroquinolone. These are antibiotics used for treating things like upper respiratory infections and even urinary tract infections. Things like Levaquin and Cipro are commonly used in walk-in clinics. If you have a urinary tract infection, you may have received these medications. Well, here's what the study showed us. So this is a study published in September 2014, looked at men between age 45 to 80 years of age, followed for a 10-year period. And in this group, there were over 6,000 cases of peripheral neuropathy, and they compared these individuals to about 25,000 aged matched controls. And what they found was that the risk for developing this devastating condition called peripheral neuropathy was doubled in those individuals exposed to this class of antibiotics called fluoroquinolones. And what the researchers also told us is that, and I quote, fluoroquinolones have been shown to be neurotoxic. Oral fluoroquinolones have also been associated with reported cases of psychosis and seizures, which, similar to peripheral neuropathy, have been shown to be acute events occurring within days of fluoroquinolone use. In light of strong evidence of unnecessary prescribing of oral fluoroquinolones in the United States, clinicians must weigh the risk of peripheral neuropathy against the benefits of fluoroquinolones when prescribing these drugs to their patients. We've got to practice medicine under the dictum of above all, do no harm. One of our most well-respected peer-reviewed journals is now telling us that the use of these medications, these fluoroquinolone antibiotics, is associated with doubling of the risk of peripheral neuropathy, a disease which often is not treatable. So keep that in mind the next time you think you need an antibiotic for this or that problem. Discuss this study with your treating physician. I'm Dr. David Perlmutter.
A closer look illustrates how the use of light therapy with infrared diodes can help promote the healing process in the body. At the basic level, all cells in the body have a miniature power plant within called the mitochondria. This is where our cell's energy is produced. The technical term for this energy is called adenosine triphosphate, or ATP for short. ATP is formed from oxygen and glucose, both of which are carried to cells by blood flow. Patients with neuropathy often have decreased blood flow, which means all cells, including nerves, are not receiving adequate amounts of oxygen and glucose. Therefore, the mitochondria cannot manufacture normal amounts of ATP. Nerves, most commonly in the extremities, sense this lack of ATP production by sending pain signals to the brain. In some cases, a lack of sensation rather than pain is the chief symptom, and this is the main reason for falls. Because the mitochondria are very sensitive to light, infrared light therapy can stimulate ATP production in the mitochondria. That is, if the nerves receive glucose and oxygen through increased blood flow to the nerves. Light energy stimulates the release of nitric oxide from hemoglobin into the bloodstream. When nitric oxide is released from hemoglobin, it enters the muscle cells in walls of the blood vessels. The muscle cells relax as the blood vessel diameter enlarges, allowing more blood to flow through the vessels. Increasing nitric oxide levels in the body offers a host of benefits. These can include anti-inflammation. Inflammation occurs when oxygen levels are too low, so increasing blood flow via nitric oxide reduces inflammation. Tissue regeneration. Tissues that need to heal require oxygen, nutrients, ATP, and growth factors. Nitric oxide provides an environment for enhanced healing. The key to accomplishing this? Better blood flow. Pain reduction. Pain occurs when oxygen levels at the nerve are too low. Think of how painful your finger becomes if you wrap a rubber band around it. The rubber band cuts off blood flow, thereby depriving nerves and other cells of oxygen. The pain recedes when the rubber band is removed. Increased localized circulation. Nitric oxide is increased locally when light energy is applied to any specific site. Along with it, blood flow increases at the same point. Light is composed of photons. Photons are quantum units of energy. A photon emitted at a specific wavelength or color contains the same energy irrespective of the source. Light near the blue end of the spectrum penetrates about 2 to 3 millimeters. Light at the red end of the spectrum penetrates about 8 to 10 millimeters. And near-infrared light penetrates about 20 to 100 millimeters. Near-infrared light is more energetic than visible light, less resistant to reflection and absorption, and therefore penetrates soft tissue to a deeper level. These are generalizations because the more red cells with hemoglobin in the path of the photons, the shallower the depth of the penetration. Remember, hemoglobin absorbs the near-infrared light energy, thereby releasing nitric oxide. The net result of light therapy is a cascade of beneficial chemical reactions throughout damaged nerve cells that stimulate healing. This response can be directly attributed to increased blood flow. This enhanced, localized blood flow improves tissue oxygenation and therefore plays a role in the following: improved sensation, which offers better gait and balance when walking; reduced pain, which can allow for better sleep at night, as well as reduced burning and stinging sensation in the extremities; increased oxygenation, which acts to reduce inflammation; and finally, increased circulation, which offers the body decreased wound incidences and shorter healing time.